Hi, folks. Welcome. We're just getting started. We'll give people a minute or two to jump on, and I'll ask all the speakers that are currently on to mute your microphones. Those of you who aren't speaking, who aren't panelists on this webinar, we can't see you or hear you, but we can see your names appearing on a list. And then my fellow panelists, while I'm screen sharing, so you know, I don't have access to the chat function or anything like that. So if there's anything urgent that I'm not seeing, text me. And we'll start in just a minute. All right, shall we go ahead and get started? Good afternoon, everyone. Good morning to my West Coasters. Our virtual Funding Forward. I'm Christina Wirtz. I'm the Vice President of Engagement and Philanthropic Outreach at Funders for LGBTQ Issues. Before we get content of today, I wanted to share with you a few notes about the technology that we're using. First and foremost, we have closed captioning available, but in order to use it, in order to see the closed captioning, you need to turn it off. So there should be a button on the upper left of your screen that says closed captioning, and you can turn that on if you want captioning of the webinar. Recording this webinar, all the participants, those of you who are watching today's webinar, your microphones are muted. We can't see you, we can't hear you. Only presenters can be seen and heard today, and in some instances, their children that will be running through. That is our new reality these days. So presenters and children can be seen and heard, but that doesn't mean you can't participate. Using polling, chatting, and the question and answer function that are all in the same button on your upper left of your Zoom window. So you can send chats to the panelists throughout the webinar, and the panelists will be able to see that. You can also ask questions via the Q&A button. Those questions will go directly to the panelists, and they will answer them at a designated time in the webinar. And we'll also be using the polling feature. So in order to use the polling feature, let's do a little practice. Alex, can you start the first poll, the one that says practice opening poll? What's your favorite thing about working from home? Sweatpants, the fridge, time with kids, pets, partners, and roommates. Nothing, I hate it. So we'll take a moment to collect those answers. One other note while these results are collecting is that there are a few folks that are designated as panelists that are not using video because there are tech folks that are helping out. If you don't want to see just their names on a black square in your screen, you can click hide non-video participants, and then you'll only be seeing today's speakers. All right, looks like we've got most of our votes in. I'm going to end the poll. I'm going to share the results, and overwhelmingly, nearly half of you prefer sweatpants as your favorite thing from working from home. I will admit that I'm currently business on the top and sweatpants on the bottom. I hope you all are too. It looks like time with your pets, kids, partners, and roommates is only 6 people. We won't tell on you. The fridge got a nice 12 people, and 6 of you hate working from home, and I empathize and I appreciate the situation that you all are in, and I'm glad you're joining us today. All right, so thank you for playing along with our initial question. And finally, on the tech stuff, if you need help, feel free to send a chat to all the panelists or email my colleague, Alex Lee, who is on the line and is our tech support for this webinar. His email is alex@lgbtfunders.org, which is also here on the slide. Oops. So with the tech out of the way, let's get started. For the past 6 years, I've stood in front of a room of about 200 of you and given you a big, boisterous welcome to Funding Forward. And I usually ask you to look around the room, connect with old friends, make new ones. And I'll admit, I have a lot of sadness that we're not together in person today. Transition to webinar is not the same. We've lost human connection. We've lost the opportunity to learn and engage in person. And frankly, we've lost the fun parts of Funding Forward. As an extreme extrovert, Funding Forward gives my work a deep sense of purpose every year. And I adore this community. And I just want to say that I deeply miss seeing all of you in person. It was 2 weeks ago when our staff and board and Funding Forward Planning Committee made the tough decision to cancel the in-person conference. And it was a completely different world 2 weeks ago. At that time, our decision was rooted in disability justice and HIV justice. We simply couldn't, in good conscience, host a convening knowing that immunocompromised people who are disproportionately queer and trans people of color wouldn't be able to come. And I'm grateful that by centering the health of folks with disabilities and HIV, we actually ended up protecting the health of our entire community. And that increased understanding of disability justice has been, for me, one of the silver linings of this pandemic. And as you all know, because you had to cancel your plane tickets and your hotel rooms, Funding Forward 2020 was set to take place in Chicago in order to lift up the lived experience of LGBTQ people in the Midwest. The Midwest now receives less funding, the least amount of funding per LGBTQ adult of any region in the country. Funders for LGBTQ issues is still committed to addressing the underfunding in the Midwest, and over the next couple of weeks, we're going to be rolling out our plan to support LGBTQ folks in the Midwest. As we adjusted our plans, the Funding Forward Planning Committee, which I'm going to show you who those wonderful folks are, has been absolutely invaluable. Not only did this strategic, smart, and fun group of people design a great agenda for you all at Funding Forward, they quickly shifted into thoughtful partnership with the funders team as we made tough decisions together. And I usually save all my gratitude for the planning committee to the end of Funding Forward, but I wanted to lift them up now because their leadership and partnership has just been tremendous. So I extend my warm gratitude to all of them, many of whom are on the phone. Thank you for helping us make this important pivot and figure out how we can continue to support LGBTQ folks in the Midwest. I also want to thank all of the sponsors of Funding Forward. They've all been remarkably understanding and supportive as we've made the decision to alter the conference. And I want to thank all of you on the webinar who allowed us to keep your registration fees. That has a huge impact on our potential to have a positive financial picture this year, despite having to cancel Funding Forward, our biggest event of the year. And while this format isn't the same as gathering in person, it's not all lost. Being able to host webinars with some of the conference content is a huge privilege. And privilege is inherent in philanthropy. And in these days, we can see that more clearly than ever. Most of us aren't working on the front lines. We're not healthcare workers. We're not doing direct service. But that doesn't mean we don't have a role to play. It's our job to move money, to move it quickly, and to move it without restriction. It's our job to ensure that LGBTQ people don't slip through the cracks of the philanthropic response to COVID-19. And so in today's session, that's what we're exploring. There's an amazing group of community and philanthropic leaders who are going to be sharing their thoughts and analysis on how COVID-19 is affecting LGBTQ people, with a particular emphasis on our elders, on people with HIV, immigrants, and Asian Americans who are bearing the brunt of the racism and xenophobia being highlighted by this pandemic. There's important work for us to do in philanthropy, and I'm grateful to today's panel for offering us some guidance. So with that, I'm going to turn it over to my boss and the moderator of today's discussion, Ben Francisco Malbec.
Thank you, Christina. And to add to the thanks, I'd like to thank Christina for doing an amazing job adapting our conference to a virtual format in these 3 webinars this week, and also further webinars we'll be rolling out over the course of the next several weeks. Her leadership, as always, has been amazing, as has our entire staff. I'm just so appreciative of our staff for their work these past few weeks in such difficult and also our board, who has been amazingly supportive. Many of you are on the line. Just so appreciative, particularly our board chair, and I want to lift up one sponsor in particular, which is Gilead. Some of our sponsors have been, we're in conversation with all of them, and some have been particularly generous and have confirmed that they are maintaining their sponsorship, and we've offered them to sponsor specific webinars, particularly the high-level sponsors. So this today's webinar is officially brought to you by Gilead, and we're so appreciative of their, not only their support, but their flexibility. And understanding that, like so many others, we have to adapt our work in this very different context. So moving into the substance of today, we knew that 2020 was going to be a hard year for our movement going in. We knew that we had major Supreme Court cases like Title VII to contend with. We knew that we had an election in which LGBT communities, particularly trans communities, and LGBTQ immigrants and communities of color would have our lives literally on the line. And we also knew that there would be state level attacks on LGBT folks with strategies from religious exemptions to these new bills that are targeting the healthcare of trans children. So we knew at the start of 2020 that all of those things would be happening. We did not know that on top of that, our movement, our LGBTQ philanthropic sector would be coping with a pandemic. So that just adds a whole other layer to all of the work that all of us do. And there's several, before we move into our panel, I just want to highlight sort of 3 layers of impact that we're already seeing, because I think isolating the layers of impact is useful. First of all, there's the disproportionate health disparities that LGBT communities face. Christina mentioned HIV. That's, clearly people who are immunocompromised are particularly vulnerable. But there's also, we know that there are higher rates of tobacco use among LGBT communities. We also know that LGBT communities are more likely to have mental health challenges. All of those make us more susceptible to this virus, or more susceptible to the many challenging factors that are coming along with the virus, such as being stuck at home alone. A second layer of impact is the economic impact, where we know that LGBTQ people are more likely to be low income. We know that LGBTQ people are highly represented in some of the industries that have been hit first and hardest, such as food and services industry, hospitality. These are thousands, perhaps millions of LGBTQ people who are without jobs now because of the various shutdowns caused by the virus. And then a third layer is the organizational layer. So our LGBTQ organizations, several of whom are represented on the line, have a higher burden of services because our population is disproportionately affected, and a higher burden of advocacy work to do, of movement building work to do, and also are dealing with loss of revenue, adapting to working virtually, all at the same time. So it's a little bit of a perfect storm. And I'm so honored to have an amazing group of speakers with us today to help us have an initial conversation about how these challenges are uniquely affecting LGBT communities and what philanthropy can be doing. So I'm pleased to introduce our panelists, who will be Glenn McPonte, Executive Director of the National Queer Asian Pacific Islander Alliance, or NCAPIA, the National Federation of LGBTQ API organizations. Montserrat Padilla, co-director of the Washington Immigrant Solidarity Network, or WISN, in Seattle. And I should say Glenn was in New York, and you'll notice that all of our panelists are from places that are on the front lines of where we're seeing the epidemic hit first, which is a leading indicator of where the rest of the country will sadly likely be in the coming weeks. And then we have Cynthia Renfro, President and CEO of Civis Consulting, who does grant-making work for several funders, including the Laughing Gull Foundation, a leading LGBT funder in the South. Cindy Rizzo, the Vice President of the Social Justice Program at the Arcus Foundation, one of the leading funders of LGBTQ issues, and a former board chair of Funders for LGBTQ Issues, and Cynthia is a current board member, I should add. Karen Scultetti, Executive Director of Open House, which provides housing and other services for LGBTQ older adults in San Francisco. So as you can see, we have a range of service providers, of advocates, and of funders. Our conversation is going to be in 2 parts. The first part, we're going to focus on our three movement experts and hear from them about how they're seeing this affect our communities. And then the second part, we'll move more into hearing from our funder experts and also some interaction via polls and other tools with all of you to have a conversation about what does this mean for us as funders and what can we be doing to respond, both in terms of flexibility, recognizing our grantees are facing a larger burden than before, and also in terms of substantive grant-making activities. So, Karen, I'd like to start with you. Open House provides housing and services for LGBTQ elders, which we know is one of the most vulnerable groups to the COVID-19 virus. And you're, of course, working in the Bay Area, which has been hard hit. Could you talk about some of the challenges you're encountering in serving our communities, and how are you adapting your work to this new context?
There we go. Hi, everyone. Thank you so much for including me in the panel today, and appreciate the work that everyone's doing across the country. As folks know, San Francisco was one of the first cities to go into the shelter-in-place sort of situation across the country. Open House operates two buildings of LGBTQ welcoming affordable senior housing, but we also serve about 3,500 LGBTQ seniors across San Francisco and the Bay Area. And what I can say we're seeing so far is an exacerbation of the things that we see every day, but on a much more heightened, intense level. So the first is, we know that LGBTQ seniors are much more likely to live alone and be isolated than their heterosexual peers. And so here we have a time of isolation where that's only, of course, dramatically increased by what needs to happen to respond to coronavirus. The second issue is around health disparities. One of the things that we know is LGBTQ seniors, even here in San Francisco, and especially trans and LGBTQ seniors from communities of color, are much less likely to utilize existing aging services that are out there. And so the problem is, when you have Meals on Wheels, who is doing tremendous work, many of the other traditional aging service providers who are stepping in to try to do things like home care, address health problems, the issue is that you know that LGBTQ seniors are already reluctant to use those services and less likely to engage in them. And so the question then becomes for us, do we start to take on a lot of services and functions that we haven't previously been doing? Or how do we build those partnerships? And that's kind of our bigger view anyway of what needs to happen to really change aging services, is we got to have a lot more LGBTQ organizations partnering with them. And then we have a lot of LGBTQ organizations who very much want to be serving seniors, but haven't previously had that as a focus area. There's not as much funding for supporting seniors as other groups. And so then we're partnering to try to help those groups figure out how do you start to serve some of the older folks. So those are the challenges we're seeing. We adapted to a completely remote workforce situation early on, which I was happy that we did, because we were sort of ahead of the curve then when the shelter in place came out. And so what we've been doing is essentially telephone support calls out to people rather than waiting for people to call us and say, I'm feeling bad or I'm isolated. We've been calling every single person who walks through the door. And again, that kind of proactivity is really required, especially for people who have a lot of heightened trauma in this time, might not know or be asking for what they need, and also unfortunately are a little bit used to feeling isolated and feeling not seen in the community. And so I really think it's important to take that extra step. I'll stop there.
Great, that's a great start, Karen. I want to shift to you, Glenn. And it's interesting what Karen raised about the reaching out proactively to offer support, because so much of what we're hearing about what's working is that sort of proactive outreach and mutual support. And I know that Incapia has been engaged in many of that same kind of activity. And so Glenn, I'd love if you could talk about some of the work you're doing, supporting your grassroots affiliates, some of the way that you're seeing that kind of mutual support play out, and also how this is affecting your work as a national advocacy organization.
Yeah, I sent a message to my panelists. I'm feeling really scared, and this is hard. And those of you who know me know that I have no trouble talking publicly and proudly about our work. But so, and thank you for the love and for being here. So, in CAPIA, the National Queer Asian Line, we're a federation of groups. We do advocacy, we bring people together, we do trainings, we bring our stories to the fore. We are a national organization, but we are remote. Our staff is all in different parts of the country. So we were set up for this. And we were easily able to transition to online webinars. But as an organization that brings people together, we can't do that. As an organization where we fight hard for our community is, how do you fight, right? And advance our rights and dignities. The BS that have been out there with regards to xenophobia, the Chinese virus, the Wuhan virus has been particularly difficult on our community. We are a movement organization and we don't do direct service work per se, but we've had to launch online support groups to support the people who are responding to others or supporting others who are facing the violence. Young people who've had to go home and have had to go back into the closet because their families are not as receptive. 3 analyses for us is that, one, like so many others, there's less money. We had to cancel fundraisers, and we are an independent organization that's mostly privately funded. And so the combination of the cancellation fees and that we have to pay more for an event that is not happening and the loss of revenue just had a compounding impact on us as an organization. 2 weeks ago, the budget was, and I had to do with 91,000. I have to calculate a different number now, and I'm afraid to calculate that number. The work has increased because we have to support communities. And we have to respond to hate. And it's not just a transition, but we saw a 450% increase in our online engagement because people are reaching out to us more than ever before. We were able to get an action alert on the stimulus package so that our community wasn't left out. So that was fantastic. But that stimulus package doesn't necessarily provide the relief that we need. There are some good provisions there for government groups that get government funding. But for us as a movement building organization, look, we sue the government. We lobby the government. We don't take the government's money. So the redress that's there and the relief, we will not avail ourselves of because we are not eligible for that because we don't have those structures. And so I want to say that we are, we've been building a reserve for a number of years. I've been through a lot over the years. We will weather this. Ooh. We will weather this, but this is going to be very hard. I'm sorry. Ooh.
No, nothing to apologize for, Glenn. I appreciate your bringing heart to this conversation. I think the feelings you're expressing are feelings that a lot of us are feeling on the line, and also that a lot of movement leaders are feeling. It's overwhelming, and I think particularly for those of us who have been through other traumas, whether it's HIV or experience of having been incarcerated, dealing with a virus, being trapped at home, like it is a lot. I want to shift to Montserrat Padilla. Montse, Glenn has talked about some of the challenges organizations are facing. Karen talked about the challenges of service provision. It's also a hard time to do movement building work. How do you do movement building work when people are afraid to answer the door if you knock on their door? So I'd love to, and of course, particularly in immigrant communities, which already were living a climate of fear, it's even more challenging. I'd love to hear you talk a little bit about how Wyson is adapting to work in the current context.
Yeah, so one, thank you so much for having me here today. It is really an honor and a privilege to be with so many resilient leaders across the nation who are literally in the front lines to beat this virus and have our communities healthy, safe, and united. As mentioned, my name is Montserrat Padilla. My pronouns are she, her, hers. I am the director of the Washington Immigrant Solidary Network. We're a statewide network of over 250 organizations that came together post the election results on November to build a defense line for immigrant and refugee communities when ICE came knocking at the door. And so already our motto in itself is a place that functions under a moment of crisis. A crisis when immigration custom enforcement comes and rips our families apart from their homes, from their workplaces, from schools, from healthcare clinics, all these other aspects of how we've seen immigration enforcement. And so, one of the things that I'm channeling in this moment, because 2020 has been an intense year for Washington State. In January, we had the entire world at the edge of a World War III with Iran and CBP agents starting to arrest U.S. citizen Iranian Americans here in our Canadian border and going against congressional will, in line to Congress, right? In February, we had the New Mexico detention center in Cibola, who shut its doors and sent our trans siblings to both Colorado and Washington State. Luckily, we were able to organize a massive pushback, and within the first month, we were able to release 14 folks who were transferred to Washington State. And now March comes with this new crisis that we're facing. In a couple months from now, we're going to be facing another crisis in the immigrant rights community, the potential decision of Supreme Court ruling on DACA. And so, yeah, I'm ready to cancel my subscription for 2020 because it's been a tough year. But with that said, I want to remind us that our immigrant and refugee communities come from a place of resiliency. Our communities know struggles, know crisis. We live in constant crisis. And so, part of this whole conversation has been just has been a realization that we are survivors as a community, and we will continue to organize to survive. However, there are some ongoing challenges on how this, just structurally, right, this current crisis is showing us that our entire beliefs on how the economy runs, on who is really the safety net of America, is being questioned and valued, right? Right now, what we have seen in the front lines of who are the safety net of America are the food supply pipelines, right? Who is having to pick up our foods? Immigrant workers in the fields in Central and Eastern Washington. Who is in our grocery stores? Immigrant and refugee and low-income and poor people who are in the front lines of the grocery stores. And also in the medical sector, we have seen a shift of immigrant communities working in the front lines. Center for American Progress just came out with a report that 26,000 DACA recipients actually worked in the medical sector. And while right now they're struggling with deciding whether they show up to work and become that troop that we need right now to protect our communities, they're also struggling with the fact that what about if I get the virus? What about if in a couple months from now, DACA is taken away from me? What will happen to me, right? And so we're living in this constant complex world where we are the safety net of America as immigrant and refugee folks, yet we're being asked to sacrifice the most, and there's very little reward. And so, or consideration of being included in those safety net programs. And so here in Washington State, just one overall, the realization that we are the safety net of America is important to highlight in this current crisis, because we have also seen the administration's new direction of using this virus. And I mean, it's not a new direction. He has always been races, white supremacists, all these things that we already know, right? But wanting to integrate a virus, something that's related to science and xenophobia together, is just creating a crippling effect. And so I want to thank Glenn for being vulnerable with us, because we've seen that violence here in Washington State as well. Our API brothers and sisters who are too afraid to ride public transportation. And then so I want to go into the next part of what we're seeing here in Washington State. Every single time that an executive order is announced, it is not announced oftentimes in a culturally sensitive way and in a way that's language accessible. It's taking or even Washington State, which tends to be more progressive, tends to have a pretty robust infrastructure to communicate with a multiple range of communities. We're having that setback where an order comes out, people don't even understand what flat on the curve means. It took me months or weeks to figure out what the hell flat on the curve meant, because those terms are not terms that we, or at least I, get to hear in my household or in my community. And so being able to explain and have this information that's coming in a time-sensitive form has been a challenge that we've seen. And then, finally, the major important part is that when those announcements are coming, whether it's from the federal administration or the state, county, or city, many of them are putting restrictions on the need for citizenship. And so right now, while we are being asked to sacrifice the most, while we are being asked to be on the front lines, we're not being included in safety net programs, and we still live with a constant fear that immigration custom enforcement will show up to our doors. Because right now they're continuing to lead their operations. In California, a couple of days ago, they showed up and did their raids with their face masks on. Here in Washington State, the Northwest Tacoma Detention Center, a for-profit detention center run by GEO, continues to function as normal, not following social distancing protocols ordered by the governor. And while farm workers are showing up to their job still in fear of them being exposed to the virus and not knowing whether they will have access to healthcare, because we're not being included in those protections. And then the fear of whether we do access those healthcare needs, will public charge impact our ability to legalize in a future plan? And so one of the main things that we have been working on has been ensuring that information is coming out in a time-sensitive form, and also in a culturally sensitive form that's language accessible. And so we actually have been organizing over the 250 organizations. We're working with immigrant rights, specific audiences, Muslim communities, Latinx folks. We're speaking to faith partners, labor partners in this moment, infrastructures that Wyson had already set up beforehand, because there was already a crisis that we were living before. And so part of the work has been, how do we use our resources effectively and don't reinvent the wheel? And so right now, there are new needs to ensure that our communities are set up to organize on the ground through a new online virtual world. And so there's new fees that folks need to be considering in some of their organizing, including text alert message fees that people are having to purchase, softwares that are very expensive that many organizations who are grassroots local don't have the funds for, being able to pay for Zoom accounts, which again, this is a whole new world of organizing, and so it's really pushing us to move forward. So thank you.
Thank you, Montse. I appreciate so much of what you lifted up, including, how this is, where there is potential to change the way people see our safety net, the way, the memes that I've seen about how, labor that was called unskilled is now called essential. In a strange way, these could be silver linings in terms of people starting to understand the value of people, of work that they didn't understand before. And I also appreciate the last part you were sharing about, all of these virtual tools that so many of us now are finding crucial are not equally accessible. So for low-income immigrants, for low-income LGBTQ people, to set up a Zoom account for elders, I don't know if we got to this yet, Karen, but maybe we will. There are a range of obstacles, from both financial obstacles to technical know-how. That we need to figure out how to, to do our best to surmount. You also started to raise some of the issue of the xenophobia that we've seen on the rise with this disease, which has gotten, in some ways, even worse, I think, in the past week or two, with Trump referring to this as the Chinese virus or foreign virus, which is just a case of blatant xenophobia and racist scapegoating. Glenn, as the leading national organization working with queer API communities. I'd love to hear a little bit more from you about how are you seeing this play out in the communities you serve, and is there anything you're finding useful in combating this xenophobic rhetoric?
You know, I was joking like 2 weeks ago that it was hard to cough and be Asian in this environment. And then last week, somebody very disturbed approached my board treasurer's home with a machete. You know, we've seen an incredible amount of violence. Both an incredible amount of violence, but also the microaggressions that have been difficult. And it's also, for us, we are not clear. When I was walking down the street, because I just needed to walk by myself 6 feet away, did the person who crossed the street because they were following social distancing, or they saw me and they saw my race? And our traditional opportunities of building support and talking with each other, of reaching out, is different now. You know, what was interesting is that in our federation, there are groups that are staffed, and most of them, some are staffed, but most are volunteer. The staff groups are actually having a harder time transitioning. It's the volunteer groups that are dealing with people, that are working with people on a day-to-day basis, that have really begun, who have really stepped up in tremendous ways and built online communities so much faster to respond, to issue statements of condemnation, to report issues out there. Because of social distancing, the violence is not physical, so that's great, I think, but it's harmful. It's harmful in the way that it's coming across. And even our traditional strategies on how to handle anti-Asian violence and bias-related violence is completely turned upside down. So I don't know.
Yeah. Thanks, Glenn. Those are powerful examples, and the the first one you shared about your board member is just heartbreaking, and unfortunately only one of dozens of such stories that we're hearing about. Karen, you and I have talked about this in our preparations about some of the ways you're seeing xenophobia play out in service provision at Open House, and the challenge of navigating that. I'd love to hear you talk a little more about that.
Yeah, I mean, one of the realities in being a senior serving organization is that we tend to see a lot of racism and transphobia in our older white seniors, especially the white men that we serve, although certainly we've had this with plenty of white women as well. And so one of our challenges is we're tasked by our mission to serve those who are most isolated and most vulnerable. And those are often the same people who are actively engaging in microaggressions and aggressions. So I had a receptionist who is Chinese, and we had to send them to home duty instead because they were being harassed all the way into work on public transportation, but then seniors coming into the lobby were taking it next level. And so that's a real challenge for us because on the one hand, we're trying to serve people, and sometimes we're serving someone who's the most isolated, and our population, I try to frame it for my staff, is they've had more years of bad education, more years of having white supremacy not lifted up or into their awareness. And so they have more unlearning to do is how we try and frame it, but that there's sort of a generosity there that I don't always feel like extending to people. And so we've tried to incorporate specific education and messages about the racist shit that we're seeing nationally, the messages, and helping people understand that none of them apply, that they're unacceptable for us. And so we've been incorporating that in all of our reach out to seniors. But it's definitely a challenge. And in San Francisco, there's a lot of competition over housing. I'm sure that's startling news to everyone. And there's already, again, a lot of horrific racism that comes up for us, even when we lease up our housing, that gets pitted as if the LGBTQ community and the Chinese community are competing against each other, and as if those communities aren't intersecting. And so I think in housing, where we are, and then in services and community building, we're seeing stuff that we deal with all the time, but again, turned up at a different level. And so I think it's imperative that senior organizations in particular, all organizations, but senior organizations in particular, need to see more of their role around education and messaging out to people that, like, it's not okay, and it can get in the way of them receiving services because there are limits that we sort of put on it. So I'll stop there.
Thanks, Karen. I think that that naming, all of us have platforms, and Funders for Issues has been trying to do this too. Anytime we talk about the virus, we name the xenophobia that we're seeing, and that nothing about this virus is race-based. And I do think, that at least helps mitigate the discourse somewhat. As we round out this piece, I want to shift back to Montse and ask you, I'm particularly worried about folks in detention, immigrants in detention, especially LGBTQ people and trans people who are in immigrant detention. We know we're often overrepresented there. Also in the criminal justice system, just the dangers that we face in this moment for those truly our most vulnerable populations. While you take a second to think about that, because I'm surprising you with that question a little bit possibly, I want to just take a tech reminder. If you are seeing multiple screens, Christina said this at the top, but admit some have joined late. You may be seeing multiple screens of people like my friends Chantel and Christina and Alex and Diana, who's helping us with closed captions. Thank you, Diana. You can make those screens disappear and just see the folks on video. These are by clicking on clicking on any person who's not on video, click on the 3 dots on the upper right, and then click hide non-video participants. Or if you have a PC, you can do the old right click and do the same thing, click hide non-video participants. And it just makes your screen a little clearer. So Montse, tell us about how worried should we be about COVID-19 in detention centers, and what can we do about it?
Yeah, so I want to start off a little bit about just this moment of reflection that I had a couple of days ago. I was lucky enough I'm one of the Borealis Philanthropy Transforming Movements grantee. We had an amazing time in Miami just a couple of times ago with over 8 trans national leaders who are building the front lines. And we were in Miami, and I happened to stay a couple extra days and found out that there was a winter festival happening, right? A couple of days after, found out that there was someone who came out COVID-19 positive. I'm also undocumented and unafraid, and also HIV positive, and I've been privileged to have access to healthcare post-diagnosis, to be able to be undetectable. And so just the constant conflict of being potentially exposed, being someone who might be or might not be immune compromised. And when I found that I was potentially exposed, I think the first thing that came to my mind was this feeling of anger. Anger to the fact that people who are undocumented don't have access to healthcare in Washington State or across the nation. I'm grateful to know that California has been leading the fight for healthcare for all, but the first thing that came to me was a moment of anger. And an anger that I remembered very similar the day that I was diagnosed with HIV. A moment of this feeling that the systems have failed me, that it felt like community had failed me for a little bit too, just to be honest, right? And me having to combat with the stigma, right? And so just wanted to talk a little bit more about the xenophobia and the challenges that COVID-19 are rising up, especially for our API siblings, but also for communities of color who at one point will, find out that they have been exposed or they are COVID-19, they've tested positive, and just the conversation around it, there's going to be very much some similarities to being able to share to your family that you are COVID-19 positive, because you don't actually have a lot of space in the home that you're going to go to, right? How do you get to isolate yourself in a house that you don't have this big fancy house? You sometimes live with more people than you can, because that's how we survive oftentimes. And so I just wanted to share that moment for realization of like, there's both the fact that there's some rules that we just as immigrant communities don't have the privilege to be able to follow, such as social distancing when you do test positive on COVID-19, that there's no other room that you can run to other than staying outside in the yard, right? Like there's just no physical space to go to. And this anger that, and this anger that will come when when you realize that the healthcare system failed you. And so one of the ways that we are organizing here in Washington State, because those xenophobic, racist remarks are actually written down in our policies, the fact that we are excluded from healthcare access in Washington State is one of the challenges. The fact that we are excluded from unemployment insurance is a crisis, is a racist policy, because we're not being seen as contributors to the economy, or we're not seen as a threat to public health concerns. And so this is the thing for just the world out there. You can do all you want, but if there's one undocumented person who's sick working in the fields, your efforts will not be holistic and you will not be able to contain the virus. And so it is important that we are removing those racist policies, both in our state, local counties, to ensure that in this current moment of COVID-19 response, everybody is integrated into those safety net programs. Now, when we talk about the detention centers, well, those are just horrific crimes that are happening. I'm genuinely afraid of where we're going to head to next. I've heard that in terms of the stimulus packages bills and the demand from Republicans to have isolated quarantine detention centers. And I don't know, I felt very afraid of that. The fact that this will allow for the administration to not really care for people who might not be exposed. And so meaning that there's going to be more people who will become exposed because of their lack of care and procedures, and then wanting to just ship them off to a detention center where they all will be sick. And then still the lack of care and support, right? And it just feels very, I don't even want to reference it to back in the days histories, but I hope that you understand what it feels like. And so part of the work right now that it is on the front lines of both combating social racism, but also combating historical policies to ensure that people can actually respond to this crisis in an effective form and have alternative solutions if they do become exposed. And so, I'll finish it off with right now. I've been called in to be one of the strategic advisors for the King County Public Health for its particular communities, as well as the Washington State COVID-19 response work group. And my biggest concern is the moment that this virus moves from the west side of Washington State, which is metropolitan Seattle, bigger cities, the west side of Washington State has more infrastructure to the response to this. Most of the funding comes to King County. We have the Seattle Foundation, who just released $10 million to be able to go to these communities. Folks need access to unrestricted funds for rental assistance, especially in undocumented communities, access to groceries, access to healthcare, access to paying miscellaneous bills. But my biggest concern is that we just got a projection of Yakima County, which is central Washington. It still has somewhat of a medium infrastructure. They're projected to have by April 11th their hospitals fully at full capacity, and 40% of the population there is immigrant communities. When you start moving a little bit further east to just Tri-Cities, in that area where it's primarily all agriculture, there's literally no infrastructure to support, and those populations are heavily immigrant communities. And so going back into who are we caring for the most? How are the safety net? Well, we are the safety net of this response. The resources, the face mask, the hand sanitizers, the ability to leave work if you're feeling sick won't be available for folks central and eastern Washington, and our hospitals don't have the infrastructure for that. And so we need to remove the racist policies that already exist, even in our most progressive states, to ensure that immigrant and refugee folks are integrated. And there's a possibility, there's blueprints for the solutions. And so we're hoping that WISN will be leading in a coalition effort, all that advocacy to ensure that we're both combating social racism, but also racist policies.
Thank you, Lindsay. So as we wrap up this piece and shift to funder work, there's a few things I want to just raise. First is just the degree to which so much of this work requires us to sort of just hold contradictions, tensions, and paradoxes, from what Karen raised around providing services to some folks who may not be very aware when it comes to racial issues, to actually explicitly racist in some cases, to what I really appreciated the tension, the parallel you raised, Monse, with HIV. And I do think there's a tension we have to be aware of between we absolutely need to do public health work, and we also need to really do this with compassion. And I think that's something that all of us learn from HIV. You know, I'm seeing so much shaming of people who are not engaging in social distancing or struggling to engage in social distancing. And I'm seeing the question coming of like, oh, you had COVID-19, how did you get it? Which really brings me back to HIV, of like, it doesn't matter how, you know, let's encourage and think about the public health messages that help people socially distance. And let's, you know, and we kind of know shame is not really a very effective promotion strategy. And also let's remember, we always need to have compassion for anyone who ends up being affected by, for whatever reason. I think looking ahead to that is really important. So I want to shift to the funder section and think about what does all of this mean for us as funders, and how can we respond with two amazing leaders to help us out. But before we do that, we're going to have our second poll, following up on the breaking win of Sweatpants at the top of the call, and ask all of you, we want to get a sense of what are the things all of you as funders are have been doing. And in particular, first we want to think about flexibility. There's sort of two pieces of this. One is, what are we doing to recognize our grantees are going through something unprecedented and offering flexibility? And then we're going to talk about the substance of sort of what can we do in terms of actual grant making to respond to this crisis. So you can see several options out here. Reaching out to grantees to ask them about their needs. Are you conducting a survey of your grantees? Letting grantees know that they can adapt their original grant deliverables as needed, waiving or loosening formal grant reporting requirements, converting project grants to general operating grants, offering access to technology and tools such as Zoom for your grantees. And you can mark multiple, and I'm pleased to see as the results are starting to come in that a lot of you are marking many of these things. That's wonderful to hear. So as we see these results come in, I'd love to hear from Cynthia and Cindy, and I'll start with you, Cynthia. Which of these are you and your clients exploring, and what do you feel? And also, what are some ways to implement them? Because it's nice to say, oh, we're going to waive grant reports, but then you still got to write a board docket. So how are you handling these challenges?
Sure. Thank you, Ben, for having me, and just appreciating everybody here on the panel and those who have showed up to hear us talk about these issues. I'm a consultant to foundations. I have two key clients right now, the Laughing Gull Foundation is based in North Carolina, and the Arch Community Fund, which is based in the Pacific Northwest. And with both clients, we have been able to pretty quickly adapt. They are small family foundations with small, tight boards who are in frequent contact, so decision-making can happen quickly. But we have waived interim reports. We had interim reports due next month. We are waiving those and issuing checks as quickly as we can. We are having one-on-one conversations with grantees, both with Laughing Gull and with the Arch Community Fund. Actually is in the middle of considering renewals for our first round of grantees that we made last year. Arch is very new. Those trustees decided they're going to automatically renew every single grantee that we made grants to last year at the same level we did last year with no paperwork. We're just having a one-on-one Zoom call or email exchange, making sure they're still there doing their work, hearing what their needs are, and we're going to cut them the check. We are also considering with Arch adding additional funding to those payments that are going out, as much as the budget there can manage it. We also at Arch have a medical hardships grant program that we just launched for cancer patients, for folks that are dealing with cancer. We're opening that up in the process right now, changing the paperwork to open that up to those who are affected by COVID-19. So that's up to $2,500 for an individual. All you have to do is fill out a piece of paper and we could cut a check to you. And that's first come, first serve until that $25,000 budget is exhausted. So keep an eye out for that. Look at the Arch Community Fund website. I find that particularly exciting. The video chat seemed to be really helpful with grantees. They are appreciating just seeing the faces and understanding that we're here for them and that we are loosening all requirements. You know, grant terms extended. We're not holding people to objectives or, you know, program goals. You know, project support to general support. Ben already mentioned that, and I'm sorry, I'm speaking very quickly, and I know that we're trying to close caption. I also just wanted to lift up a conversation I had this morning with a grantee who mentioned that one of their grantors just sent them $10,000, no question asked. That wasn't us, it was somebody else. But, you know, I was great. My trustee was on the call, so I was really grateful for him to hear that we can do that. Yes, we can do that kind of thing. But also that when we asked if it would be useful to add money to their grant, you know, Arch has a limited budget, they said, we're fine. We've heard people with a lot more emergency needs than we have right now. And if you have those grantees that need that extra money, we're not saying no, we'll take it. But if you have other folks with really extreme need, move that resource to them and not to us right now because we're fine. And I'll stop right there.
Wow, that's an amazing example of collectivism in a sector where so often, particularly grants, are just seen as a really competitive sort of zero-sum game. So those are some great examples, Cynthia. And so I'm gonna quickly share out the results again, just so you folks can see and shift to Cindy. So reaching out to grantees, grantees know they can adapt their original grant deliverables, and loosening reporting requirements came up very high with 79% of you saying yes. Converting project grants to general operating grants is fewer with half, and about 38% are offering tech tools. And then only 25% said they're conducting surveys of their grantees, which is kind of good because if 100% of you were conducting surveys, that would be a lot of surveys for grantees to answer. So that maybe it's good that that one isn't as high as some of the others. So that I want to shift to you, Cindy. What is ARCIS looking at doing as you start to respond to this crisis, and what are you hearing in the sector in general?
Thanks, Ben. First, excuse me, by way of introduction, I just want to lift up, I think all three of the movement leaders who spoke were really helpful and powerful. And so I appreciate that. But I want to particularly lift up Glenn because Encapia's gala was this month. It's a very big event for them. They had to cancel it, which I was very sad about because I was going for the first time. And not only did Encapia lose money and, you know, and ask people not to get refunds and all that, but then they started a fundraiser for the restaurant workers who would have worked at their event. And, you know, Chinatown in New York and probably in many other cities where there are Chinese communities and Asian communities like Koreatowns or Japantowns are really feeling the brunt of this. All restaurants are hurting, but they were way ahead of the curve. And so the fact that Encapia made this gesture of asking folks to help the restaurant workers really moved me greatly. And so I really appreciate that leadership, Glenn. Turning now to ARCIS. We sent out an email to all of our grantees from their own program contacts very early on March 12th, which right now feels like a lifetime ago, telling folks that we would remain flexible, that we would help them retool grants if they needed that, if they needed grants to end earlier in order to make the money be spent more quickly and on more urgent and unanticipated needs, that was a possibility as well. One good thing, and this may be true of many funders here, a large portion of our U.S. grant making in social justice is general operating support. And so our grantees already had quite a bit of flexibility with our funds. The idea, the added assistance of telling people they could end early only enables them to use that money, as I said, on unanticipated expenses. The other thing we did was, and this was inspired by Isabel at the Hazen Foundation, who also came out very early with a very concrete offer of assistance to their grantees, which was Zoom licenses. We took that idea and adapted it to our own grantees and offered, and this is a small gesture admittedly, but it was very early on in the situation. We told our grantees that if they needed to purchase licenses or software to enable them to work remotely that they didn't already have, that we would reimburse them up to $500 for that. So these were some of the early things that we did. And we continue to monitor our grantees. I know Desiree's talking to multiple grantees every day. She's the US program director at ARCIS. The other thing that's noteworthy, and I don't know how many funders are on the webinar who fund outside the US, but the situation is a little different outside the US, and it's a more delayed, other than in Western Europe. It's pretty, and of course China, it's very delayed in a lot of the global South. We fund in Africa, we fund in Mexico and Central America and the Caribbean, and we weren't seeing some of the early problems with those grantees as we were in the US. So what we anticipate is that will be the next wave of concern and need that we will have to respond to. And our International Program Director Adrian Coman and Program Officer Erica Lim are also very much in touch with those grantees, including many intermediaries that fund a lot of grassroots groups in those global South regions. But our message was that we are continuing business as usual, although working 100% remote, that grants will continue to be paid, that grants will continue to be reviewed and awarded. There will be no cessation of any of the ongoing activity. Then ARCIS is not an emergency funder or rapid response funder, but many of the intermediaries we fund are doing that and able to use our funding for those purposes, especially if their grants have that kind of flexibility, or if they request that their grants have that flexibility. What also happened, and I'll stop with this next little piece, is that Desiree and I were contacted by our grantee, Equality Florida. Many of you know Nadine Smith, their executive director, asking how we could be helpful, or in even just brainstorming ways to increase coordination and information sharing among movement organizations at every level, national, state, and local grassroots organizations. And Funders for LGBTQ Issues was very generous in offering their resource page on COVID-19 funding and other resources for the movement as a sort of informational clearinghouse. So I would really urge you, if there are resources, funders will put them up on their website, and that'll be really helpful to folks who are accessing that. And I would also urge you to let grantees know that that clearinghouse of information exists so they can access it. There are many, many emergency funds, many that came up by community foundations around the country and other funders. So people should know what they are. I worry that that queer organizations are always on the outside looking in when these things come up, when these funds come up. And so it's our responsibility as funders in this space to really get our folks the information they need to apply for that money. Other things that we've been in touch with 4 other of the sort of larger LGBT funders, the Gill Foundation, Haas Jr. Fund, Foundation for Just Society, and Wellspring. We're a group that normally meets and talks to one another and is trying to share information about how we're responding to this situation with one another. And I know that at GIL, the federal agency project that they work very closely with is looking at the legislation that Congress has passed around assistance, trying to make sure that folks in our movement get the information that they need in order to apply for that. There's a lot of issues, and you should definitely bring those to our attention in terms of cultural competency and other kinds of issues. I know Montserrat was really very clear about who's being left out of a lot of that assistance. And so we need to be mindful of that and respond to that. And I will stop there so there's time for the rest of the program.
Thank you, Cindy and Cynthia. That was great. As you can see, we asked Cindy and Cynthia to join us because they really are modeling so many of the practices in terms of flexibility. We've, and one of our goals for this webinar is, we all have, unless there's any actual large multi-million-dollar donors on the call, we all have folks who we're accountable to and systems that we have to work within. So part of our hope was to lift up that people are doing this flexibility. To that end, we've received a couple of requests to share the polling results again, because people have asked to screenshot it to share with perhaps boards of directors in some cases. So we're going to share again briefly. Please do take a screenshot, and you can show colleagues on your senior team and among your trustees that indeed just large percentages of funders of this LGBTQ funding community, and there are LGBT funders on the call, and there are many mainstream funders who are integrating LGBT issues into their work, are integrating these sorts of strategies that are offering grantees much more flexibility than usual. And some of these may be strategies that we might want to consider implementing more long-term, being more flexible and having more I and thou sort of relationships with grantees, more trust-based philanthropy is probably a best practice that we should implement whenever we can. So I'm going to stop sharing. Hopefully you all have had enough time to grab the results. A couple other things that I'm seeing coming up from participants are, one, Cindy mentioned our resource page. Alex shared that with all attendees. That does have a list of LGBTQ rapid response funds, including formal ones. There's one housed at Pride Foundation serving the Northwest. There's one housed at Horizons Foundation serving the Bay Area. Those, I strongly encourage you to look at those. We also link to other indexes of fund, many community foundations in the United Ways have set up funds. LGBTQ organizations should apply for that, find the ones in your region and apply for those for emergency support, and use some of the data, some of the other links you'll find on our resource page to make the case. So all of us should be encouraging our grantees to make use of those resources. The Hazen Foundation, which I have a feeling might be our friend Isabel, also shared a sign-on letter for funders to promise to continue providing support and to honor multi-year commitments, which is a major concern. There are really at least two levels of crisis here. There's the virus itself, and then there's the economic impact. And some funders are considering lowering their payouts, which is particularly troubling in a time when nonprofits are already facing all the challenges we've discussed. Other funders, I will say, many funders have rolling payouts of looking at a 5-year average of their endowments. I think that's a much better practice in terms of smoothing out any effects of the economic ups and downs on grantees. We want to shift into an even more interactive piece. This is a little bit of an experiment. We've done this on webinars of 50, but never one that's closer to 100. So bear with us. Christina, could we shift to the Google slide sharing? So what we want to do is we want to hear from you about what is your foundation doing or exploring to address the impact of COVID-19. You'll see Alex just shared in the chat box a link to a Google Doc. All of you should be able to access that. And what you can do is, if you look, you see in the lower left-hand corner, this is a Google Doc all of you can write on. There's a Post-it stack. Grab one of those Post-its and just share anything that your foundation might be doing to address COVID-19. That could be rapid response funding, it could be capacity building, it could be anything else. There's also a star cachet on the right, which Christina is helpfully pointing to. And if someone else has already written something you're doing, grab a star and throw that on top of someone else's Post-it. And then just try to, you know, dozens of people are going to be in this document at the same time, so try to be conscious of, if you see someone else writing in a certain place, don't write directly on top of them. And we will see how this works, but our goal is to get some real-time feedback. As we do that, I'd love to hear, having heard from Cindy and Cindy, any of our movement leader panelists want to respond and hear about things you've seen funders doing that are helpful, or things that that you'd wish more funders were doing? Yeah, Glenn. Oh.
I'm back. I'm back. So one conversation that I think will have to be had in some way is many of us who had events are now suffering from cancellation fees. And we have to pay more money for an event that we did not have. That's an awful thing to raise money for or to give money for. And our stuff is fine, right? Because our stuff is fine, but I think that there are many organizations that have events at hotels. And so I'm gonna ask some people who are in funder collaboratives just to kind of think about that as you talk to your grantees. I know that I'm afraid to raise it with my funders because it doesn't feel good. And who does the money go to? A large for-profit company like the Marriott, you know, who's gonna get a bailout. We don't have that on airlines, but that's the one thing that those of you who fund organizations that use these meetings and conferences as a strategy for change, y'all might want to think of. And the other thing is some analysis around how does the Senate bill impact our sector, who are more movement-based, who don't have a government grant. And there's a few of my colleagues that are also asking the same questions to the extent that there's some joint thinking, because as I've said before, even you don't have enough money to fund all of this. That's just the reality. You can give me the biggest grant, there's not enough. And so I think we need to think of strategic ways of accessing other resources and using what we have in innovative and strategic ways to make bigger impact. Money helps, but I think the influence of the philanthropic community on government actors and on states and localities might be much more impactful. I mean, you should still give money too, that's important, but there's other things to do where I think your power and privilege could extend and impact communities in a much bigger way.
Thank you, Glenn. So I want to take us to this. Oh, Karen, do you want to jump in?
Sure, I can be quick. Just to echo Glenn's sharing, we also are one of the many organizations who've canceled events. And there's both dealing with the hotels and then also that, you know, we've had sponsors and ticket buyers stand with us, and that's been amazing. But then your day of fundraising is obviously all goes bye-bye in the cancellation scenario. So yeah, I know there was some conversations by some local foundations here, even thinking about like, if when your gala gets canceled, you can like ask for a grant specifically around that, because it also feels like a really weird time to hit up individual donors to support that, because you really want them supporting the services and the needs of the seniors. And yet without that fundraising, you can't do that. And so I think that's, to pull that up, if people have a coalition that can work with Marriott, they own almost every hotel chain in San Francisco, and they need some advocacy at the national level. I think we ultimately got them to work with us, but that's because we've gone to the same hotel 3 years in a row, and I think they started to feel like they would lose us. But in general, Marriott's stance has not been cool. And And then the other thing I'll just always, I'll never be on a funders seminar and not say this, is just to remind folks that a very, very small percentage of foundation giving goes to seniors. And to Glenn's point, there's certainly government funding that does do some work for seniors, but not necessarily for our community. So if this is a time where you would think about talking to your existing grantees about ways they might reach out to more older people, or you'd think about whether seniors can be more of a priority, I'll always encourage people to think about that, because it's less than 2% of the funding, and I know that's been discussed by this group before.
Yeah, of course. And when it comes to LGBTQ seniors, LGBTQ funding is 0.25%, senior funding is 2%, and I don't know the number offhand, though. Alex, that Andrew and Lyle could share it tomorrow on our numbers call, our numbers webinar that will focus on that data. The percentage going to LGBTQ seniors is just absolutely minuscule. So I just want to call attention to some of the things that we're seeing come up here. Thank you so much, all of you who are participating. It does help if you want to see it a little more clearly. You can sort of expand the screen share piece of your screen and minimize all of our beautiful faces on video for a moment. Some of the things that are coming up, several people mentioned launching rapid response funds or expanding their rapid response funds. Some are shifting to renewal calls, doing sustaining grants, as Cynthia mentioned, sort of not asking for a formal renewal process, but just sort of going ahead and renewing grants, sharing resources, expediting the application process. We lost the screen share for a second, Christina. There we go, it's back. And continuing to take information by phone versus accepting written application materials. So a lot of great stuff on here. And I see some folks are noting who you are when you do this. That's great. Do feel free to mark that, because we can continue to add this to our resource guide and to our own tracking of what different funders are doing. Oh, and I see some of you are already going to the next one, which is great. So we have one question so far. Do feel free to type in questions in the Q&A. I want to ask this question, and then we'll go to the last interactive piece. So someone asked about, first of all, a lot of folks are expressing appreciation for the panelists, and I share that and want to echo it. We have a question asking, how can philanthropy work to combat the white saviorism, which seems inevitable? We live in a world where the president takes no responsibility for the crisis and systemic oppression, but all the credit for socioeconomic stimulus and progress. He's constantly lifting up blind patriotism that perpetuates racism and xenophobia. Given that predominantly people of color are on the front lines or providing support in these times, how do we as foundations center their work and efforts and shift narratives nationally to give credit where credit is more than due? And Monse, I know you said you wanted to jump in on this particular question.
Can folks hear me? Okay, perfect. Yeah, so I think just to give you a little bit more context about Wyson, the first ever grant that we received, our first $100,000 grant that we had received in partnership with the Northwest Area Foundation, we decided to re-grant $50,000 out into Central and Eastern Washington back in 2017, because again, the resources were always huddling around the western part of the state. Very limited to no infrastructure was developed in Central and Eastern Washington, where most immigrant and refugee communities were living, working in agricultural rural areas. And so being able to redistribute resources into areas where there is high need but very small infrastructure is critical right now. And being able to have trusted partners who you can make sure that they're engaging in a grassroots approach is important. You know, Wyson has been engaging in mutual aid since we started. The fact that we accompany folks to courthouses, because there's immigration enforcement operations now at courthouses, is a way of mutual aid. Now, as COVID-19, the new way that we're adapting our mutual aid model is to ensure that if people are feeling sick, if people are high risk or have compromised immune systems, that we ask them if they're able to stay in their homes and to be able to disperse resources, groceries to their homes. And so a lot of the infrastructures that have been needed have been trusted tools like a community hotline, right, where folks can actually engage and interact with them. And that's something that Wyson has had for the last few years, where people have been calling us. At any average week, we receive around 60 calls where people are either reporting ICE outside their door or reporting their loved one just picked up by ICE. And so we have been engaging in emotional support. And so one of the ways that we've been building up these rapid response infrastructures have been always centering this, we always start off, especially with our allies, this powerful quote of Lila Watson that goes, "If you have come here to help me, then you are wasting your time. But if you're here because our liberation is intertwined with one another, then let us work together." And so that has always been the grounding framework of Wyson when we're engaging. Thus far, we've been able to build over 29 rapid response teams in 22 counties. We have 39 counties in Washington state. And again, our #1 focus has been a redistribution of resources from the west part of the state to central and eastern Washington, where there has been limited to no infrastructure. And so one of the things that, as folks are answering these questions, one of the things that we appreciate, one, Wyson has had a lot of new work. This coalition building takes time. This redistribution of resources takes time. Trust, right? It takes a lot of trust overall. And so we appreciate that some of our partners have reached out and said, "Hey, you should apply for this grant." And that's actually really helpful, because right now, as organizations who are a little bit smaller, Wyson has 3 staffers, and having to at this moment scale up because there's just so much work has been the fact that funders are realizing that we're able to connect people to those grassroots organizations to directly fund them. And it's been great to see some of those foundations roll out some rapid response funds, and most of our members being able to receive them, which is, it allows us that we are all building together our capacities to organize to this new grounds. And so I think it's important that one, it's how the framework of their organizing is happening, and also ensuring that the redistribution of resources is an essential part, and that the need to not always hold on to those resources. I really appreciated the story of Cynthia of organizations saying, we don't need that, please send it to others. That's something that we're helping facilitate to ensure that those resources are widely spread, and looking at the needs particularly and the infrastructure available so that it's equally and equitable. And so I really appreciate being able to work in that model where folks are realizing that in this moment, philanthropy and this grassroots and organizations, we need to work as a communication network to be able to get into the ground quicker, faster, and more effectively.
Thank you, Monse. So some of you may have seen, we had a second slide that was sort of, what are your hopes and dreams for the sector in terms of what can philanthropy do? How could we level up in this crisis? Something happened that we didn't anticipate. We anticipated a whole bunch of problems, but one of our many wonderful shared users deleted that slide. Unfortunately, when we're doing a shared editing like that, we share in large mistakes, like deleting a whole slide. So we will try to get that back. There were a lot of great stuff on there. Maybe we did you manage to rescue it, Christina? If so, we can take a quick look at that as we close out. It's back. Yay! Thank you to Alex Lee, who is, among many other skills, our amazing tech whiz. Can you shift to that slide, Christina, so we can take a quick look at it as we close out? So we wanted to end on a little bit of a positive note, and look at some of the, what are some of the big things philanthropy could do to really step up in this challenging crisis. And we're seeing a whole range of things like de-siloing the work, signaling maximum flexibilities, using rapid small funds for tech and other unexpected needs, trying scenario planning for what the future works looks like, providing capacity building dollars to help advocacy service grassroots groups, and trying not to inundate grantees or the Quest got a lot of stars. Feel free to add to this. We will pull it and we will use this to guide our own work and to think about what future conversations we can have. I am conscious of the time and just want to see if any closing thoughts around how we can step up in this crisis, particularly from any of our speakers. No, we have limited time, so it's okay.
Can I say really quickly, Ben?
Yeah, please do. Cynthia.
Something Hazen and Laurie and the Hazen Foundation brought up on a recent call is thinking ahead. Recession hits the bottom line the year after and then the following year. And so be in that conversation with your grantees and also with other funders around how do you maintain the same level of grant making the next year when your assets have taken that hit and the year after. And if you can't, be in that proactive conversation with your grantees.
Thank you, Cynthia. That's very wise. And Christina has stopped screen sharing, but that Google Doc is still live, and feel free to keep adding it. I also saw multi-year Gen Ops grants coming up, the perennial mandate for social justice funders. So I want to close by just expressing so much appreciation to our panelists. I thought you all shared a lot of wisdom, you shared a lot of insight, and you shared vulnerability. And I'm so appreciative of it, and doing it in real time. We're sort of all figuring this out together. So thank you for modeling that. And thank you to all of you who joined us. Thank you, Glenn, and for your patience as we, as we experiment like all of you and are trying to do virtual work and also trying to make it more interactive than just a few talking heads. And I'm going to turn it back to my wonderful friend, Christina, to close us out and invite you to attend our other webinars this week.
Great, thank you all so much. Monse, Karen, Glenn, Cynthia, Cindy, Ben, that was such an inspiring discussion. Honestly, it was more than I thought that I could get out of a webinar. I'm inspired to host more of these conversations. You offered the funders on the call so many concrete steps they can take to continue supporting and increase support for their LGBT grantees. I'm really grateful for the centering of people with disabilities, people with HIV, our queer and trans elders, API folks, and the countless queer and trans people of color who are on the front lines of this crisis, healthcare providers, delivery people, grocery workers, and other folks who have jobs that are critical to the functioning of our communities and jobs that are often so undervalued in society. So thank you for those voices and giving us concrete examples. Big thanks to all of you who attended and rolled with us as we altered the format of Funding Forward. Don't forget, this is just the first of a series of webinars. We're doing 2 more this week. Tomorrow, we'll be hosting a webinar with the brand new 2018 tracking report, which will be coming out tomorrow, with an emphasis on funding in the Midwest. And on Friday, we're hosting a webinar sponsored by the Johnson Family Foundation called Queering Democracy, looking at our democratic institutions and how LGBTQ people are or not included, something that I think is top of mind for many of us right now in this super shifting and unstable landscape. And then into April, we'll be doing further webinars on some of the topics that we had designed for Funding Forward. And I really, again, appreciate you all rolling with this format and being a part of our various experiments. So thank you again to our speakers, and I look forward to seeing many of you tomorrow, same time, same place. Not same place, different link. You have a link in your confirmation.
Probably the same.
I'll be in the same place, yes.
Thank you, everyone. Take care. Thanks, Christina.
Bye, folks.